Hello, good afternoon, and welcome to the third session in the Health Economics program.
Good afternoon, sir.
Hello, good afternoon. Can you hear me?
Yes, sir, I'm hearing you, and I'm seeing your slides up.
But you're not seeing me.
Yes, we're seeing you also.
I was hoping you did not have to see me, that you just see the slides and you have to hear me and you did not have to see me. You know, sometimes
We
you
can,
say that children should be heard, not seen.
we can see
Okay,
you and
thank you.
hear you.
Good. So, as I indicated, the third session, we want to look at the whole matter of the healthcare marketplace and the whole concepts and matters pertaining to demand, supply, and price in the market. And you may begin to ask me the first big question: why it is in health we have to be concerned about the market? What is it about the health system or the health care that makes it a marketable item, a good or service? And once we go through the presentation, you will begin to see why you need to understand how demand, supply, and price play a key role in what is happening to healthcare. Remember the case that we were looking at yesterday when we saw that the government intends to put in additional taxation on sugary beverages. Now, one of the big questions which they had to answer in their modeling is, if we put in a new tax on sugary beverage, by how much will demand for the beverages fall? And therefore, that is going to have an implication for the incidence of diseases related to sugary beverages and these kinds of things. And it is not only a matter of how much the demand is going to fall, people's behavior. Are they going to respond to that change? Is it a big enough change to cause them to respond? Because just saying that there is a price change and people respond, miss the point completely. How big is the change, and by how much will their demand be affected? And those are some big questions which you need to put on the table as part of the analysis. You also have to put into the analysis, well, what is going to happen to the business firms which are producing the commodities? Are their earnings going to fall so much, their profitability going to fall so much that they stop or they slow down or they reduce production? And what is that going to do with employment, etc., within the community? And if people lose jobs, then they lose buying power. And of course, if they lose buying power, there are some things in health which they cannot buy. So there could be spillover effects that you also want to bear in mind. So these are some of the considerations you want to look at. Sometimes when you're working in the public sector, you don't consider things like demand and supply. You sometimes automatically assume that because you have a health facility, people will show up. And in the public sector, because the services are generally at no cost when people show up, you assume people will come. But then we do know that even though antenatal care has no cost, do we get all the likely mothers showing up for antenatal care treatment? Do we get all the children showing up for immunization? Do you have persons who are adhering to the medication protocols and prescriptions, even though they get it all at no cost at all? What is it about demand? People don't show up. What causes people to show up for treatment as against bear the illness or not show up for treatment? And is there, just because you have a facility, does it mean you're going to have a demand? And then if you're working in the private sector, you also have to consider your supply. If you just graduated and you put up your office and you say, now I'm going to be seeing patients, you have to consider, well, what is the competition in the marketplace? How many other doctors and suppliers are there? You have to consider, what price am I going to charge? And is that going to be a an attractive enough price so people will come to me, because at the end of the day, I have bills to pay. I have to collect some money at the same time to put into my pocket. So from that viewpoint, the business of healthcare that you are in is a business. You're looking to generate revenue in order to get earnings for paying your bills and other things as a supplier. And you have to understand what's happening in the marketplace, what's happening all around. So demand, supply, and the price that is being charged are important considerations. And then you might begin to find out that, wait, even though I charge a higher price, but what happens if people's income had increased? What happens if, because there are salary agreements and salary increases, people's income increase? So even though my price increased, if their income would have increased by a larger percentage, will they still demand and show up for treatment? So a number of implications which you want to consider over here in looking at this. You might also want to consider, if you're going to set up your office, your lab or your pharmacy or your physiotherapy center or your dentist office or your medical clinic or whatever it is, you might also want to ask the question, well, am I going to be catering for elderly persons who require a lot of care, or am I going to go to a community where there's a whole lot of young people who are very active and who are very healthy? Okay, where will I set up my office in order to generate the kind of revenue that we're looking for? So age may play a role in persons seeking treatment altogether. And these are the kinds of considerations which we want to throw into the mix when we look at the whole matter of the healthcare marketplace. And interesting enough, when we were speaking yesterday about even though the public sector seemed to think that they should not be concerned about cost and they should not be concerned about price and to take that for granted, the literal question that they have to ask is, if the public sector is producing or is providing a service that is at a higher cost than you can get it in the private sector, is that an efficient use of resources in the country? The money could have been used for some other thing. So let us not automatically assume that because we are working in the public sector, we don't have to take these factors into consideration. Right, that's my opening blow. So what is it we're trying to do? We're trying to look at how does economics come into the mix when we're looking at healthcare decisions, healthcare choices, healthcare behavior, healthcare practices by professionals, medical institutions, and patients at the same time. And we look at some of these concepts and tools like market demand, cost effectiveness, optimal reimbursement, etc., in looking at this. And I like the little cartoon on the right-hand side over there, because sometimes we think that, these are old questions. But, as the world has become a bit more complex, and it has become a bit more complex because a lot of persons can now get their healthcare advice online. So you could put up your office and develop it and make it all fancy and whatever it is, intending to attract patients, but patients are going online for their advice and for their prescriptions and so on. So what are you going to do? How are you going to respond to that kind of competition? So as the healthcare world becomes a bit more complex, sometimes these old questions about 2 + 2 don't always make it, for you have to come up with a different kind of formulation. Right. I put this back in here because we looked at it yesterday, and you were probably wondering why we want to talk about the business of medicine. Well, there are a number of things, there are a number of statements which are made inside of here. When you think about them, They relate to the marketplace for healthcare. And that's what we want to consider. More treatment. Does more treatment mean that you're going to get better outcomes? Lifetime of treatment. Amenities. Does it mean that the quality of your care depends on the quality of your amenities? Is that what is going to bring people to your doorstep or to your office? More competitors vying for business. Does it mean that prices will fall? Economies of scale. If you're a large clinic as against a small clinic, does it mean that you will do better than this small clinic? And these are some of the things which the business of medicine try to grapple with. Pause. Anybody query, want to raise anything, throw anything into the mix from early on? All right. In healthcare and in health, sometimes we like to assume that people value their health, that people want to be healthy. Well, you can't automatically assume that people want to be healthy. There are some people who will be very happy and very contented being sick. Well, why would they want to be sick? Because you see, when you are sick, you get a lot of attention. You may have a lot of relatives coming to look for you and look after you and providing all kinds of things for you. So sometimes you want to play sick. You may not be sick, but you want to play sick, to get the kind of attention you're looking for. Or you may have a condition, but you see, you may not leave and go and seek treatment. And that's why you can draw a distinction between having a need for care and seeking treatment or demanding care. They're not the same things. They are two different things. So firstly, you have to decide, is this a sickness or is this an illness which is going to stop me from functioning? Physical functioning, mental functioning, going to work, studying, and all of these things. That's what we call the instrumental value of health. And then health, of course, is desired because it makes you feel good. And that's part of it. So we say that health has both intrinsic and instrumental qualities. And this is why we think people seek to get better health. But don't automatically assume that everyone wants to be healthy, because it's not just a matter of getting attention, but there's some people who like to feel persecuted. There's some people who like to feel and go through troubles because they somehow think that if you don't have troubles in your life, then your life is not worth living. And how can you talk when you meet up your neighbors and you conversing and you want to say, well, how are you? You say, oh, I'm not feeling so, this thing happening to me and that thing happening to me. It gives you a certain kind of attention in the neighborhood. And some persons may want that. And so automatically assuming that people having a need and that they will show up for treatment is not going to be a simple one. What makes people seek care is what distinguishes your need from your demand. Because if you are sick and you don't show up for treatment, there's no demand. We can't count you. And if there's no demand, then it means altogether, then there's no utilization. Then you could set up how many hospitals you want. You could set up how many clinics you want. You could set up how many antenatal centers and so that you want. You can have all your vaccines and so waiting over there for people. If there is no demand, if people are not showing up to get it, then all of that, just sit down and wait. So don't automatically assume that because you call yourself a health professional, or because you have your medical office or your dental office, or you have your clinic, or you have your hospital, that people will come. Can't automatically assume that. You have to understand demand behavior, health-seeking behavior, what is a need and what is a demand before you can actually determine if people are going to show up for treatment and you can earn some money. So the table over there, which I put inside of there, shows you can have a need, yes or no. And then do you actually demand? Do you show up for treatment, yes or no? If you have a need and you show up for treatment, then you fit into, in my second column, you fit into that box, yes, you have a need, you show up for treatment, you demand services, so your needs are met, generally. If you have a need and you do not show up for treatment or there's no demand, then you have what in health is called an unmet need. If there's no need, but you still show up for treatment, then we like to call that frivolous demand or non-essential demand. And you have many persons who don't really have an illness as such, could easily deal with it at home, but they still show up for treatment altogether. And we call that frivolous demand. And sometimes you might want to have a user fee in place to deter that kind of frivolous demand.
I have a contention with that, sir.
And no demand. Yes.
Good afternoon, everyone. Good afternoon, sir. I have a small contention with that because are we then not contravening our position as champions of preventive care when we say something like that?
So you think that if there's, because now we're championing preventive care, even before something happens to you, you show up for some kind of care, or you show up for some kind of
screening or some, right, you know, because then the need, is it the need as determined by the patient or the need as determined by the system? Because perhaps from the system perspective, you know, it's not a need, but from the patient side, it's their need, you know, I guess. And of course we can discuss need versus demand, but as champions of preventive care, to say it's frivolous to for the person who has no apparent need or acute need, for want of a better term, and then they come in for care, you know, that it sort of contravenes what we say we stand for.
Oh, that's an important distinction, but also position yourself as a health worker in a very, very busy clinic. All right, in a very, very busy clinic where you have a whole lot of screaming people and babies and whatever in front of you, what do you think you're going to pay attention to?
I agree, sir, absolutely, but that's circumstantial.
So if you and you see someone who come in there and you know they're walking very casually and come in there, well, you know, I just come here for a little bit of advice, you know, a little checkup and whatever, and that. I mean, the response is not going to be as positive. Look, I have all these other people to deal with. The triage process will not even let you through the door. Remember, you still have a triage process when you're dealing with very busy facilities. So, yes, but it's a very important consideration. So you don't like the term frivolous?
No, sir. I don't like that term, sir. But I understand what you're saying.
What about the term now? That's why I put in stroke, non-essential. Would you prefer non-essential?
Non-essential is you know, I'll work with that one. Are non-emergent then, because it is essential. But I'd say it's non-emergent. So it's not an emergency, or it's non-urgent. You know, but that gives more context. It frames it in a particular circumstance and gives a very specific interpretation than frivolous or non-essential would suggest otherwise.
Good. So I think we'll hire you at the Ministry of Health, Akeem, because, you know, now that we want to put a tax on sugary beverages, you will not tell the population that it is a sin tax, because the population will not want to feel that they are sinners to the word.
Yes, sir, and it's
you
important,
like
sir,
because frivolous. You don't like the word sin.
No, well, so But I think we have to all recognize that language is very important, and language
Uh,
can be used as a weapon, as it has been used in many senses, and we see that time and time, especially today
yeah,
in the current events of the
yeah,
world. And language can
yeah,
significantly impact how people receive messages and how they respond to it. So we have to be very
yeah.
careful about the language we're using.
Good. No, point taken. Point taken. All right. And then, of course, if you have no need and no demand, then that's the desired health state that you're looking for. But there's a clear distinction which you can begin to see, and there are a number of reasons why persons may have a need and not show up for treatment. Because maybe it's the cost of the treatment, maybe it's because of the distance they have to travel, maybe it's because they can't get time off from work. Maybe it's, it's because they don't like the quality of care that they're likely to get at that particular facility. Maybe it's because they have other major concerns, house rent have to be paid and children's school fees also have to be paid. So they're prepared to forego a certain amount of health on their side in order to ensure that some of these other priority matters are dealt with. So then, there are a number of reasons why need may not always be translated into actual demand or health-seeking behavior. So somehow you need to understand that part of it. If you look at, for example, in Jamaica, you have always been doing what is called a Jamaica Survey of Living Conditions. In the survey of living conditions, in the health section of that, they always ask a series of questions. And they ask persons, one of the first questions they ask you is, have you been ill or injured in the last 4 weeks, 1 month? Have you been ill or injured? And persons answer yes or no. And the follow-up question to that is, did you seek treatment? And you may be very surprised to see the percentage of persons who declared they were ill or injured, but did not answer the question, are they seeking treatment? And you begin to ask, why? Why didn't you seek treatment? So look at the survey of living conditions and begin to track it down, and you can see there's a need, but it's not always translated into a demand. And that's a real data set for 20, 25 years that you have in front of you to look at. We bring back our friend, need or not need?
Need on the side of the patient.
Well, there's a demand. We know there's a real demand. Is there a real need? You want to draw a distinction? Sorry?
Psychologically.
Psychologically.
Psychologically, what the person needs is psychiatric evaluation and antipsychotic medication, not interventional procedures.
Mm. Oh. But anyhow, let's not presume to understand what is going on in the mind of Mr. Alves. Well, I can't say Mr. Alves anymore, but let's not presume to know what's going on.
Well, that is
but
true
I put that
too,
again
sir. We can't
to
say that.
highlight the matter. Sorry?
I was saying, yes, sir, you're right in that regard. We cannot presume to understand. That's correct.
Right. Because although the doctors have warned him against additional surgeries, he said seeking out more cosmetic procedures has become a need despite the health risks. He is defining a need, and that's another distinction which you might want to make. Who should define what is the need? Is it the patient or is it the professional?
But his practices are unhealthy or can be deemed as unhealthy. What he's doing can be seen as unhealthy. It's like somebody addicted to cocaine. After a while, they feel like they need it in order to survive, but it's to their detriment.
All right. So you think that the health professional is in a better position to determine what is needed than the individual? Okay, we'll hold you to that. We'll hold you to that. Because if it depends on how I'm paying you, the health professional, well, the more you do, the more you get. What do you think you're going to do?
No, but that comes down to the morality of the professional.
Okay. And you assume that all professionals are ethical and moral and upright.
Well,
I
we
know,
spit on
that
oath, you know,
interest
sir. We
obligation.
say do no harm.
yeah, but that's the ideal, but not the reality.
We'll pick up that discussion again later on when we're looking at provider payment methods. All right. So let's assume then that you have a need, you want to get better. You can't go to work, you can't study, you can't do a whole lot of things, go out to have a normal life. You want to feel good so that you're ill or injured, so you want to get better. So now you're going to show up for treatment. What does it affect your health-seeking behavior? Is it the price of the service you're looking for? Is it your income level? And how do they work? Because if the price increases, normally the relation between price and demand is if the price increases, demand is likely to fall. We know that generally from normal market goods. In healthcare, does that always work?
No,
Does
it's
that always work?
realistic.
Maybe not in public care. Maybe in private care, it's like the GP price goes up by, a few thousand, and it's outside of your bracket or what your insurance will cover. Maybe increase the price or go public. A lot of patients have been coming publicly because they can no longer afford private care.
Yeah. But generally, I mean, in the normal marketplace, this is what you will expect to happen, which is why the sugary beverage tax is related to this. They put a tax, you increase the price, you expect demand is going to fall. That's what you call an inverse relation generally. And if we do a graph to show that, because economists like to draw a graph, this is what you're going to find happening. If the price is at P1, then the quantity demanded is going to be way over there at Q1. So that's what is demanded. If the price goes up, you expect the demand will fall from Q1 to Q2. And that's a general pattern that you may find in the normal marketplace. In health, it does not always work like that. But if you're in a very competitive business environment, you may very well find that you have to be very cautious about what price you are charging for your service. But sometimes the price may go up. But what about if you expect demand will fall? What if people get an increase in salary? Now they have more buying power. And if they have more buying power, then you can expect that they will have higher levels of demand for health services as against those who may not have all of that buying power. So then you have a direct relation between income and demand. And again, that could be shown on a graph. It shows an upward sloping graph like this. When you have this level of income at Y1, your demand for services will be like around Q1. And if you have an increase in income and earnings go up to Y2, then even though the prices may have increased slightly or would have remained the same, you can now do more. You can, get more visits, do more tests, get all the medication that you want to get, and all of these things because your buying power would have increased, so your demand would have moved up like that. So that's two factors that you want to bear in mind. Now, remember when we started off, I indicated to you that sometimes you assume that because the price looks, or there's no price, or there's no fee, that there'll be a lot of persons coming to seek treatment. But don't automatically assume that if the price is zero, that you're going to have a lot of persons coming in. Sometimes, persons who have health insurance that covers their wellness package, they cover annual checkups. And how many people make use of the annual checkups as part of their insurance package? It's paid for, but do they use it? as I indicated, antenatal care clinics, free. Immunization clinics, free. But yet still, you don't have 100% coverage. Why? So don't automatically assume that if there's a zero price, that people will show up for care. Generally, however, once there's a price and the price increases, your due will fall and vice versa. Income works in a direct relation, just the opposite. If your income increases, demand is likely to increase. What about the supply of goods and services? You have more doctors, you have more labs, you have more pharmacies. Can you generally find that demand is going to increase? Well, somehow you have more pharmacies and you don't know where more people are coming from to demand pharmaceutical services. You don't know where more of these lab tests could be that are coming from. Yet still you find that there's more facilities, there's more demand. Is it that there's a lot of demand that was hidden, that was not coming from, but now there's a supply or there's no constraint? Then you find that there's a direct relation. If the supply of some healthcare services increase, then generally you're going to find that there might be or demand is going to increase. But remember, in real life, you don't only relate to health services and the price of health. When you have your salary coming to your bank account at the end of the month, you have to balance what I want to do with health with what I have to do with education, what I have to do with paying for the car, the loan for the car. I have to consider what I have my mortgage to pay and all of these other things. I have to consider the price of food in the supermarket. So if the prices of other goods and services are going to go up and you have to balance your budget, you may find that you might cut back on some of your health care, health demand. And that's why in my fourth point over there, if the prices of other goods and services are going to change, then your demand is likely to change. Is there a relation between age and demand? And yes, and it works in a mixed way, because initially, very young children, there's a great need, there's a great demand. So then demand is going to be quite high when you're very young, when you're into adolescents and adults. And so then you find that your demand is likely to fall, and as you get into the elderly stage, then your demand is likely to rise. So therefore, you have to look at that in relation to your population. If you're opening your healthcare business, your dental office, where do you want to be? Do you want to go to a place where you have a whole lot of persons who have very good dental health? Or do you want to go to a place where you find that there are people who need your services? That's how you make the money. Unless, of course, you can induce demand by offering all kinds of other services that persons will want to utilize. And that's part of the marketplace that you have to consider. But generally, you're going to find that if the population is very, very young, like young children and elderly population, those are the age groups where you have a higher level of demand. The sixth one, any difficulty with the sixth one? Does the sex of the person have a relation to demand? Generally, it is felt, or I suppose it is the research which has pointed out that women seek more care than men. Now, why is that? Why is that?
Birth.
Is it
Gynecological
natural,
issues,
genetic? Sorry?
I was thinking gynecological issues.
Gynecological issues. Any other issues? Is it that women?
Their early introduction to the healthcare system, maybe like with family planning and antenatal care, as opposed to men. Men probably, when they were younger, they would have come for vaccines and so forth. But after that, apart from school medicals, there is no service that is like directed to them until they come, maybe like for curative later on, or from injuries seeking curative care.
Yeah.
So a girl from 16 can be seeking family, maybe not family planning, but even family planning, you know, those type of services early compared to her male counterpart at 16 as well.
Yeah. Does it have anything to do with men's view of health, their psychological view of health? They don't want to be seen as, I mean, health has been looked upon as a weakness. And for some men, you know, it's not masculine to be seen as unhealthy. Or you kind of hold it and hide it for as long as possible. And then when it's very, very late, then you show up for treatment. Is this how health-seeking behavior is likely to take place? So there's generally a mixed relation. And if you're going to set up your clinic and you have a lot of females in the population, then it's good to make sure that you have specific clinical services geared towards women rather than men, because you might get more business in that way. And that's part of the business arrangement you're looking for. I mean, we're still sticking with the binary sex relation that, you know, are sort of F and M, but, and there's no big set of data yet on what is happening to the trans population. Of course, the distinction between sex and gender has become very, very real. And in that context, you know, there are 57 or more different gradations between F and M that you can consider. So the binary world that we once thought that was the only world possible is now further fragmented into all of these. And some cases, some people, this morning I feel more F than M. So, you know, so I will dress and think and behave and whatever as F. And tomorrow, you know, I feel better, you know, I feel better. Well, not better, but I feel different. I feel more M than F, and that's what I may dress like. And this gender fluidity is something which you also have to bear in mind when you're looking at setting up your office. Has anybody seen any studies on the demand for health services by the trans population?
Not necessarily like directed towards it, but it's more so kind of seeing news or headlines in terms of antagonisms and largely based out in the UK. Yeah.
All right, well, that's a big area of research. Education levels, do you think that if people are better, well, educated, more years of schooling or, you know, more secondary and tertiary level education and all of these things, that they are likely to demand more services than persons who are not, who may not have all these years of schooling and so?
Well, sure. With education comes awareness.
Awareness.
I think it could be double-pronged in a sense. In that,
but does,
how you want to put it? In terms of possibly with like less education, it's not necessarily it is that they wouldn't want to seek healthcare. It's more so the case that the kinds of healthcare that it is that they look to seek wouldn't necessarily fit in the conventional methods for study. So more education, you'd probably have a greater, I want to say, appreciation for, I want to say, like scientific and regular pharmaceutical medications, versus it's not like it is that persons less educated are less prone to illness. It's more so that they might look for more naturopathic routes, which might not be picked up.
Yeah. So education, but does it also mean that a little education could be a dangerous thing? You know, I go on Google and I read up about this and all of what treatments that are available, and I come and I demand more things from you, the healthcare provider. Is that something which we also need to bear in mind?
We are simply scribes for ChatGPT, sir.
Okay. My point number 8 about what determines demand, insurance coverage. Does it mean that if you have more insurance or a better package, you're likely to demand more services? Quality of care is their direct relation. As quality of care increases, then demand is likely to increase. And that's something which you can all take on board. And then this one, which I suppose this is part of your curriculum, the whole matter of culture. How does the socio-cultural value system in your country or in the community affect the demand for healthcare? I mean, remember in the case of HIV, for many years, the stigma associated with HIV meant that a lot of persons did not show up for treatment. So the cultural values within the society could also play a role in terms of healthcare demand. It can encourage or discourage demand for health services. Any other aspect of culture you think? Is it the same cultural values which determine or which make it easy for men not to show up for treatment and to delay as long as possible because it is not masculine as part of the culture of the country?
Yes, and more recently, we can talk about vaccination too.
About?
Vaccination.
Right, vaccination, right, yes, yes. Yeah, now you can bring in the whole matter of vaccination and cultural values, get into the mix and questioning whether, this is safe, this is effective, and more than that, whether you should be moving more towards natural remedies as against going for this kind of formal system kind of remedies, etc. Is that a twist in the whole thing that you need to pay attention to all in looking at demand? So when you're looking at the health business and you're looking at the health setup and health services, even if you don't have a price for your service, and that's why I put all of these factors inside of here, even if you operate in the public sector and there's no price or no user fee for the service, yet still you have to contend with several of these factors in relation to, are people going to show up for treatment? Because if you're in the public sector, your quality of care is bad. If there are cultural values within the system which probably discourage people from coming forward, then you're going to find that they're not showing up for treatment, even if you find altogether that you have services available and you have all the qualified persons who are there, but there's some other factors which you also need to bear in mind when you look at the demand behavior of persons. Any query on that? Okay with that? Okay, good. All right. But demand is not a straightforward matter of more or less. Demand is a matter of how much more and how much less. In other words, then, what is the degree of responsiveness or the degree of change in quantity demanded in response to other changes? What's the degree of change in relation to price? That's why I drew the example at the beginning about the tax on sugary beverages. What is the degree of change? How responsive? If the price, for example, like in Barbados, the price or the tax on sugary beverages went up by 10%, but demand did not fall by 10%. Demand did not even fall at all. So then the price probably did not have an impact. By how much should you increase the price for there to be an effect on demand? That's what you want to consider. Not just that demand will change more or less, but by how much. And that is something that we call the elasticity of demand. Elasticity simply measures how responsive or what is the size of the change in relation to the price of the service. If income levels would have gone up, by how much would demand go up, or the prices of other goods and services that people have to spend on. If food prices go up by a big chunk, if, for example, you find that gasoline prices go up by a very big chunk, if school fees for the children go up by a very big chunk, then what is likely to happen with respect to your demand for health services. Some things you might think, well, you know, I think I could deal with this on my own, or I can just go to the pharmacy and get something without even going to the other medical professional, or I could postpone getting my surgery for a bit of time until I can clear my other bills. So you have to look at, for example, how demand is likely to change in relation to all of these. And that is what we call the elasticity. How quickly or how large is the change? And it's usually measured using calculations. That is, what is the percentage change in the quantity demanded divided by the percentage change in price. And I'll show you how this works out in practice, just a simple arithmetic. And the values can range from -1 to +1. If there's a positive change, if in other words, you find that the percentage change in demand is greater than the percentage change in price or income, then you have a very elastic demand. And if it's a very small change, then you call that an inelastic demand, which means that the percentage change in demand is much smaller than the percentage change in price or income or other goods and services. Numerically, this is how it works out. What do we mean by percentage change being greater or smaller? Well, if you look at, let's say you have pharmaceuticals, hypertension tablets or diabetes, insulin or something like that you're working with, or you know, you have your medical practice and it is $2,000 for a consultation, but you see, I'm going to send it up to $3,000. What is likely to happen to demand? Well, normally what you're going to find happening is if price one is $10 and there's a change in price, so it goes up from $10 to $12, then the change in price is $2. And the percentage increase is the change divided by the original price, and that is 2 divided by 10. So that's a 20% change in price. So prices went up from $10 to $12. That's a 20% increase. But what happened with demand? When my price was $10, I was getting 100 people coming to me. Number of visits, 100 visits. When I send up my price to $12, then demand fell to only 40 visits. Price increase, demand fall to 40 visits. What's the change? There's 60 less visits at the new price than at the old price. And so you have 60 less, which is the change, divided by the original demand, 100. That's a 60% change in demand. Elasticity measures percentage change in demand divided by percentage change in price, and that's 60 divided by 20, and so you get 3. 3 is greater than 1, and whenever you have elasticity that is greater than 1, then we like to call that elastic demand. So when you change in your price, be very, very cautious what is likely to happen with demand. This means as prices rise, there may be a very large decline in the number of visits. And if there's a very large decline in the number of visits, what is likely to happen to your business or to your earnings? When the price was $10 and you had 100 visits, you could earn $1,000. P1 times Q1 is $1,000. When the price went up to $12, you only have 40 visits. So P2 times Q2 is $480 you're getting. You are losing, or you are poorer by $520. So you change your price thinking that it would not have the big impact, but it did have a very big impact. And so you're losing money altogether. So you have to be very careful and cautious how you're changing your prices. If you're working in a pharmacy, which medication can we change the price? And that is not going to affect the demand very much. And which medications we cannot. If you're working in a dental office, which procedure, working in a lab, you have to consider that. And in health, sometimes persons are very responsive to changes in price, and you can have that kind of behavior showing up. Straightforward numbers, anything to grapple with there? Anybody?
My comment, I guess I just say, sir, but I think you sort of touched on it in a pharmaceutical sense or a service provision sense. It depends on certain circumstances, because while perhaps the general rule of thumb it is so, for a highly specialized service or an exceptionally rare condition or a highly, contested or highly demanded medication or something, it might not be the same response, because if that commodity is extremely rare, there's one supplier or one service provider, then one may say that person has all the leverage. They can push their price up to
That's why you sort of jumping me. That's why I have my second case. That's why I go to the next one.
Sorry.
No. That's fair. You're thinking ahead of the game, which is good. And that's why you have the difference between elastic demand, where you have the percentage change in demand is greater than the percentage change in price, is greater than 1 numerically. Then anything you see is greater than 1, you say, that's very elastic. What about it being inelastic? It might be such an absolutely necessary, essential service that you could send out the price by how much. Medication is absolutely necessary. You might be the only supplier for that medication, and that's a good position to be in. Because if your price is $10 and you change the price to $12, then we know that that's a 20% change in price. But look at what happened to demand. In the second case, first level of demand at $10 was 100 visits. In this case, demand only fell to 95 visits. So in other words, then the change is 5 visits less, and the percentage change is 5%. Elasticity is percentage change in demand divided by percentage change in price. That is 5 divided by 20, which is 0.25, less than 1. And when the percentage change in demand is less than 1, we say that your demand is inelastic. Now, inelastic demand is very good news for the providers, because even though there might be a small decline in visits, look at what's happening to your earnings and your profits. When you were pricing at $10, you had 100 visits, you're getting $1,000. Now you change it to $12, a small change in demand only. You have 95 visits, so that you're now earning $1,140. It's a good thing that you change the price. You can now earn more money. Secret there. Secret there. Does it mean that you can keep changing the price because you control the market? Should you behave like that? I mean, you can. There's nothing would say is that you cannot. But should you? Anybody?
Depends, I want to say.
Yeah.
It depends. If it is how you want to put it, in the context of no competition, then clearly that's not the case in terms of how you want to put it. If you're the only person in Hakim's example, you're the only person who provides this very highly specialized service or this good, right? And you recognize that this good is borderline essential. We can call it like fuel or whatnot. It shouldn't be the case that you are able to continuously increase the price to whatever suits you, based on the fact that you've assessed that you have an inelastic demand, because in that sense now, I don't know, it's just kind of basically like really kind of breaking the system, so to speak.
Monopoly on a product.
So you think then that health professionals should have a social conscience and be driven by ethical factors and all of these things?
In my utopia, nobody can have a medical degree and an MBA at the same time.
Yeah, well, I'll keep coming back to this over time, and you're going to see why I put in the whole matter of the business of medicine. What does it matter if the people can pay? Remember, we're only looking at price here, because if the price change like this, you might assume that demand is going to fall by so much, and you get worried. But what about if people's income had increased? Does it counterbalance the price increase? And therefore, the amount of visits might not fall by so much. So in a dynamic marketplace, this is just looking at one factor. In a dynamic marketplace where you have multiple factors operating at the same time, it is not always as straightforward as this. So that's what you have to consider. So sometimes you could change your price and demand is not affected because income would have risen. And so people have more buying power and they can still come and pay the bills and you can get away. So consider that in the marketplace. The marketplace is not unidirectional or unistructural. It has many other components inside of there. Right, we do the graphs, economists like to do graphs, that's the price and demand. I think we showed you that, and the income and demand, the positive relation, the negative relation. As one rise, the next one fall. As one rise, the next one also rises with it. So there's a direct relation and an inverse relation that you can consider. All right, anything on the demand side? Anybody want to throw up anything again on the demand side? You're still operating in a marketplace, still looking at this. So now we have to look at the other side of the equation, the supply side. Because the market has a demand and a supply side. And the supply is how many providers are going to be willing to supply services, to set up their offices, to set up their clinics, to build hospital beds, even in the case of insurance companies, to offer health insurance, in the case of training schools, to offer education, health education, and all of these things. It really is what is the quantity of health goods and services that firms are able, willing to provide to meet the demand by patients. And supply health goods and services offered by health professionals, health facilities, health insurance firms, health training schools, all of these will be considered as aspects of health services altogether. So you're looking at a market for all of these things. What's the market for health education, training MPH students? Is there an MPH program in UTech? Anybody knows? Is there?
I think so. Yeah, there is. Isn't there?
There is.
Yes, there is.
Is there a market MPH program at Northern Caribbean University?
There's one there as well.
There's one there. And of course, there are online MPH programs that you can do.
Yep.
Yes, sir.
Yes, there is. So then why choose UWI?
Easier not to have
why
to...
choose UWI when you have competing suppliers? Is it the price that brought you here? Is it sentimental values that brought you here?
You don't have to wait for the transcript. They have it.
All right. But go back to health services themselves, and you can look at that. The supply of services then relate to all of those suppliers who are willing and able to supply, to provide services to meet the demand. And as you said, there's a range of demand for all different kinds of health services, and you have all different types of suppliers in the marketplace. What determines, just like how we looked at what determines the level of demand in the population, what determines the level of supply in the population? Well, one of the first factors you look at is what is the pattern and quantity of demand? If there's no demand, is there likely to be a supply? I mean, supply generally responds to some kind of demand in the marketplace. Of course, you can have a supply, and a supply can induce a kind of demand in the population. Previously, probably there may have been very little cosmetic surgery that is being done in the country. Now you find that there are more surgeons, more supply, and somehow or the other, there's a demand. Where did that demand come from? And those who can't get it locally, they go abroad to get the treatments. So, and a range of other services you can look at where supply can create its own demand, but generally you're going to find that the supply is going to respond in relation to the pattern and quality of demand. And there's a direct relation. If demand increases, you're likely to have more pharmacies, more labs, and all of these things, because there's a demand altogether in the marketplace. Supply very much also depends upon what is the price in the marketplace and what is your expected earnings from investing in that business. If you have money in Jamaica, would you put it in pharmacies? Would you put it in labs? I mean, there are other competing businesses that you could put your money in, but you might put it over there because, again, for some of the values, but because you expect to earn a certain amount of revenue. And so expectations from your earnings in health as against other places could play a role in looking at, are you going to be supplying services, how much? Because remember, the business, the firms, the investment decision in health now is not only health professionals investing in health. It's not only health professionals building medical clinics. It's not only health professionals who are setting up labs or setting up dialysis centers or setting up wellness centers or setting up pharmacies. Could be a lot of business-oriented persons who have no health training, but they see it as an area of business to make an investment. And that's why, in some other countries where it's a private business, you have a whole lot of companies, large companies, limited liability companies, which have health as a business. Some of the large companies own chains of hospitals, and nobody in the management structure of the ownership has any health training. So it's a big area that you can look at. There's money to be made from health. And therefore, if I can get my earnings, then there's going to be a supply. Similar to prices and expected earnings from competing services as another factor, technology. The technology of production. Okay. At one time, it was, if you're looking at pharmaceuticals, at one time when you're doing a batch of medication, you have to make sure that your facilities are geared towards making this batch, and you have to retool and reorganize and whatever in order to make a batch. Now, because of the technology, you can produce thousands or millions of tablets, just by the flick of a switch. Technology has changed, supply has changed, and so you find altogether that the marketplace is now responding to that. There are now many more training facilities for medical doctors or pharmacists in the country, including online training, and therefore you're likely to find that the supply is going to be moving in that direction. So where the technology of production is changing, technological improvements in drugs, equipment, diagnostics is going to lead to a decrease or increase in the quantity of goods that is likely to be supplied. And the final factor which I have there is the whole matter of government policy, government regulation. Is government encouraging business development in health? Are there subsidies? Because sometimes government allow private firms to bring in medication and other things, at reduced customs duty or no duty or something like that. And therefore you could set up your facility. That's the kind of encouragement that you get from the government policy. And sometimes it's very restrictive. Like in the case of some medication, you can't bring in that medication because it is not in the formulary. You can't get it registered. Is that a barrier to business? So sometimes government policy could be barrier, but sometimes it could also be encouraging investment and supply of goods and services. Right, determinants of supply, any queries on that? Okay with that?
I'd say, sir, well, I'm not sure how much we touched on it, but I'd use the word malicious or I want a better word to describe certain practices that may be utilized in synthesizing demand or regulating supply that are somewhat nefarious, to say simply, and are indeed unfortunately practiced, as we have seen historically and today, where certain commodities are concerned.
Again, you're going back to the behavior of the supply side of the equation. I mean, is there a demand for it? I mean, you could be as nefarious as you call it as you want. Is there a demand? Can you expect a certain level of earnings? And when you look at the whole matter of provider payment system, which is going to come up, you're going to see, for example, how it is that the suppliers can have certain practices which can be considered at some level nefarious, but might be considered as part of the business. It might be considered as, a part of earnings and how you can stretch the concept of the market or the rules of the market or the laws of the country in order to do some things. If I'm not breaking the law, let me do it. I can do it. All right. Supply is very much related to your cost. And I think that you would have done some of this already in financial management and accounting. What is fixed cost, what is variable cost and total cost and this kind of thing. So then, your supply, because in order to fix your price, you must know your cost. We assume that in the public sector, you're not worried about cost. Well, I can tell you, if you're not worried, Ministry of Finance worried. So when you tell Ministry of Finance, well, it's help, give us what we ask for, Ministry of Finance say, is not so it go. Try something different. They're very concerned about how much money they have to put out because they see it as a cost. You might think, well, it is health, it is an investment. No. I still have to find the money. So you have also to be considering the cost, because at the same time, the Ministry of Health and the public sector has to consider, can it be done cheaper or more efficiently in the private sector? And if it can, then it means altogether from a national point of view, the money is not being efficiently used. So let's not automatically assume that because it is public, it is safe or it is good. Probably you can do the same thing better and cheaper in the private sector. And that's where you want to put the money. From an efficiency point of view, consider that. So you have to be paying attention to your costs in the public sector. Right, if you take, for example, something like dialysis, there are some centers in dialysis, some dialysis centers, which can operate on a 24-hour basis. That's all they do. Dialysis, they specialize in doing dialysis services. While you in the public hospital might be multi-faceted, you have a whole number of other services that you have to provide. You may not have all the professionals to work in the dialysis unit all the time, 24 hours. You don't have all the nurses, you don't have all the other related supplies inside of there. So if somebody is doing this 24 hours all the time, then you can find that their unit cost is going to be much less than yours in the public sector. And then what would you do? Do you still want to keep it in the public sector? When we were doing some work in Bahamas, we found out that it is cheaper to send patients to Miami to get their MRIs done than to do it locally. They said, but it's local. It's supposed to be use local sources, buy local and all of that. Yeah, but I can pay your plane fare. I can pay your hotel stay for 1 night or 2 nights and get your MRI and bring you back. And still it is going to be cheaper than what it is being done locally because the facilities in Miami are 24/7. That's the only thing they do, MRI services. Hundreds of machines, all the time they open, unit costs could be quite low. I mean, that's why probably you send people to Panama or some other places. Unit cost are like, so you have to be concerned looking at your cost and don't automatically assume that because it's being done in the public, it's cheap. It may not be cheap. So your fixed costs are your major cost. Your variable costs are the moving expenses like salaries, supplies, which change as your output change. And you put the two together, you have your total cost, and your average cost is going to be your total cost divided by your output, or how many services how much services you're providing, or how many students you're training, or something like that. And you have your average cost. But there's another cost that economists are very concerned about, and that's the one that is called the marginal cost. And I will show you how that works out with a numerical example. You set your price in relation to your average cost. And if your price is equal to the average cost, then you're just covering your bills. There's no profit, no surplus. If your price is greater than your average cost, then you're getting a profit or surplus. And if it is less, then you're running at a loss. And how long can you run the business at a loss? Depends very much on what is the amount of backup funds that you have. Numerically, this is how you put them all together. 1, 2, 3, 4, 5, 6. Oh, I should have my 6 column. Number it, number 6. You're now starting the business, so you haven't produced or provided any service or sold anything or seen any patients, but you still have to have an office. You still have to have your a rental or whatever it is. You still have to have utilities and so that are running. So you have fixed costs which you incur. There's no variable cost or very little variable cost. I'd still leave it as dash because you haven't been producing anything yet. You're just setting up your office. Total cost is FC plus VC, that is still 100 because there's no variable cost. You're not producing or providing any service. Then there's no average cost because you have no production or no service, and there's no marginal cost at all. Now you start seeing patients, you start seeing 5 patients. Fixed costs remain the same office, same place and whatever, but now you have to buy supplies. Now you have to keep the bills running. You have to keep your electricity supply running, your water supply running. You have to hire a receptionist or something like this. So you have variable costs. Total cost is fixed plus variable, that's 400. Average cost is going to be total divided by your quantity or your output, how many people you're seeing. That's going to be 400 divided by 5, that's 80. But now here's what's happening. Now you have what is called a marginal cost or a change in cost. Originally, my total cost was 100. When I'm now starting the business, now it's gone to 400. So there's a change of $300 in my total cost. And that change divided by the change in quantity or the change in the number of people I'm seeing, which is 5, is 300 divided by 5. And that is going to be $60 I consider as my marginal cost. A marginal cost becomes very important later down because you will find out, like if, for example, you're doing immunization. Initially, when you start immunizing children or other persons or whatever it is, then a lot of persons come to you. But then there are a lot of other persons who may not come to you. So you have to drive out to reach them. And the further you have to drive out, the higher your unit cost of immunization is going to be. Those additional costs are what we consider as your marginal cost, and your marginal cost is likely to be very high. If you're looking at, for example, lab tests, if you want to test for some types of cancer or whatever, then you do the first test in order to screen and find out, do you have something that is suspicious or you don't have something suspicious? Then we want to validate it, and we go to another level of testing. And then you might go to a third level of testing to revalidate or make sure you do not get it wrong. Then each level of testing means that there's a higher level of cost that is going to be involved. And that's what you consider. What is the marginal cost of having to do all of these? So the marginal cost sometimes could rise by very, very high, even though your average cost might be more flat. So now you're seeing 10 patients, your fixed cost is the same. In fact, in all of them, the fixed cost is the same because that's fixed, and your variable cost moves differently. Total costs rise by just $50. So your unit cost, your average cost would have fallen, and your marginal cost would have fallen. You move to 15, but what happens when you start seeing 20, 30 patients or doing 30 tests or something like this? Fixed cost is the same. Variable cost gone to $950, total cost is $1050. My average cost has started to move, to change, because $1050 divided by 30 is 35. But look at what is happening to my marginal cost. To move from seeing 25 patients to 30 patients, I had to do a lot more advertising. I had to do a lot more promotion and a whole lot of things. I had to change up things probably in my office and whatever in order to get persons to come there. So my marginal cost would have moved from $40 when I was seeing 25 patients to $50 when I'm now seeing 30 patients, because my total cost would have been increased by a larger percentage than the percentage change in the quantity or the number of patients or services that I'm providing. So marginal represents the change. Average just represents the average. Total divided by how much you're producing. Marginal represents what's the change in quantity, the change in cost in relation to the change in your quantity. And so you put all of these there, and that's what you're very curious about, because the business, from an accounting point of view, your average cost may be the essential factor. But from an economics point of view, your marginal cost is also very crucial, because it tells me how quickly your costs are changing in relation to changing number or changing demand or changing levels of utilization. And that's what I'm concerned about. How quickly is it changing? And that's your marginal cost, and then your average cost, your total cost, your variable cost, your fixed cost in relation to your supply side. Any query there? Anybody want to look at something there again? All right, and then we can begin to play around. We can begin to play games, especially if you like graphs. You can begin to play games with graphs, and then you can begin to see, well, what is likely to happen if price change? What's going to happen to demand? What is going to happen to supply? Rise in price is likely to lead to more supply because you could make more profits, but a fall in demand. And the reverse is likely to happen. Is that good news or that is not good news? When the demand is equal to the supply, we say the market is balanced. There's no surplus, there's no shortage. When there's a shortage, it means demand is greater than supply, and so you have persons having to open their doors for long periods. If you're selling tomatoes in the market, you're carrying home tomatoes because you have excess in your hands. Here's the interaction between demand and supply and price. At a low price, $1, then the demand is for 10 units, but the supply is only 2 units. There's not much profit to be made. So there's a shortage in the marketplace, right? Demand is for 10, supply is only 2, and therefore you have a difference or a shortage of 2. So the suppliers say, oh, business looking good, things looking all right, that there is a demand. So then the price goes up to $2, more supply is coming, demand would have fallen because price would have dropped from 9. And so there's still a shortage of 6, but so there's still some place for more supply in the marketplace. And that's what the businesses do. I mean, that's what happens when pharmacies decide to set up new pharmacies in some locations, or doctors' clinics go up in some locations where you feel you already have a large supply, because somehow they assess the market and determine there's still a demand that is outside it that is not being met. So then you begin to keep changing your supply in relation to changes in price, and then demand is going to change. At some point, you're going to have the price is going to equate your demand with your supply. We call that the equilibrium. There's no shortage, there's no surplus. If the price goes up to $9, demand would fall. Supply would have gone up, and there you have a surplus in the market. You open your doors for long hours, and not many people coming through your door. Your electricity bills are going up and other things and whatever. You have a surplus, and if you have a surplus in the marketplace, and that's not good for your business. It means you have unsold services, or you have a whole lot of time in your hands that you did not bargain for. You're not as busy as you should be. And that's one of the things about the interaction of supply, demand, and price. And as I said, you could play around with these in the form of graphs. When demand changes, this is likely to happen. When supply changes, what is likely to happen with demand and price, and all of that kind of interaction. That's your market. That's your market. That's equilibrium. Price is low, demand is likely to be at a particular point, price goes up. But somewhere they're going to find a balance, and in the market you have this kind of very uneasy balance that you call equilibrium. When there's no surplus supply, there's no shortage. And you've just met your demand. It's very unstable. It doesn't stay very much, because the key thing about business intelligence is that you have to be tracking developments in the market. What's happening to price? What's happening to income? What's happening to quality? What's happening to the aging population? Where should I locate my business? What kind of business should I be going in altogether? You keep doing that market intelligence to determine, if I put up my office, I put up my health business, am I going to have clients and customers and patients coming through the system? In the marketplace, of course, you have what is called number of transactors, and somebody asked the question about if you are the sole supplier. Yes, you're the sole supplier, only one supplier selling or offering services. Then you have a monopoly, then you could do anything with prices. You are a sole supplier. But there can also be a situation where there's a sole buyer. If the government is the only one who is paying for providing these services or buying these services from you, then the government controls the show, then the government can determine very much what price they are willing to pay. And you call that a monopsony, where there's one major buyer in the country. And sometimes that happens in business, because you could have a large business that contracts with a whole number of suppliers for taking all the supply of certain produce, like milk or oranges or whatever vegetables you might be producing. So you have one buyer. Now they can control the price, and they can control how the business will operate. Then you can have two transactors another way. You can have a duopoly if two sellers, duopsony if there's two buyers only. And then there's a few, that's where the whole matter of oligopoly and cartels come into being. Where there are a few sellers, you call that an oligopoly, and a few buyers, you call that an oligopsony. Or you can have many suppliers, many buyers, you have a competitive market, and then you can have a situation where you have a perfect market, where you have many suppliers, many buyers, all with fairly similar products, but they have the same price. And many buyers who have full knowledge of what is their health condition, and therefore who can supply the service. And that's going to be what we call a perfect market. And a perfect market does not generally exist. although you might be approximating that, economists like to talk about a perfect market where there's perfect knowledge. In health, the patients do not have perfect knowledge. Patients do not know enough about their health condition. They do not know enough about the treatment for their condition. They do not know enough about all the complications that are likely to arise as side effects from the treatment and all of that. They depend on you, the health professional, and you, the health professional, could take advantage sometimes of that lack of knowledge in order to do your own thing. And that's where an imperfect market occurs in health, because in health is very much an imperfect market. You don't have similar products, you don't have similar prices, and you don't have full knowledge by the buyers or the patients of how to manage their condition. The buyers depend upon the sellers or the professionals who are offering the services. And that's an imperfect relation which can open itself to a whole lot of other kinds of practices, which we will talk about later down in the sessions. Right, the market. Queries to anyone? Want to raise anything there? Okay. Okay. All right, if no queries, then you have the presentation in front of you. You have the handout, which I see is available here now in the classroom. You can get a copy of that, and you have a couple of readings which you can look at. And one of the big questions which usually comes up is what makes health care different from other goods and services in the marketplace? What makes it different? And some people may ask, what makes it similar to other goods and services? And what is so unique about health? Because we like to think that health is very, very unique, and it is absolutely essential. As I said at the beginning, don't automatically assume that everybody wants to be healthy. I mean, it's a default position. Yes, you value health because you feel good and it makes you do things, you can function and whatever and all of that. But sometimes you can come across persons who just like being considered as sick. We were doing some work in a clinic in St. Vincent, and one of the nurses, the nurse in charge of the clinic, was telling us that, you know, because it is a clinic in one of the rural communities, there's a particular person who used to show up every day at the clinic, every day, because that was a social occasion. It was a place where you go to meet friends, where you can talk to the doctors, where they can give you attention, you can feel wanted, you can feel somebody, like if you are somebody. And 2 mornings, she did not see this particular person coming to the clinic, and met her on the street when she was going home and asked her, well, how come I did not see you at the clinic? And the person responded, I was sick, man. I was really sick. I couldn't come. So sometimes people show up for treatment for reasons, or they show up for care for reasons other than pure health reasons. You have to understand the culture of the population in some of these situations. All right, but generally, we would think that if you have a need and you seek care and you get it, you get your attention, then your need would be met. And that's the desired state that you're looking for. If you have no need and no demand and no supply, then we can all consider ourselves in the wrong profession. There's no need for our services, better look for some other private profession. But we have done our market studies. I'm sure you have done that. And you determined that there's a need for my services in the country. And that's what I'm being trained for. And so that's the objective in this. So marketplace, let's begin to think about this in our healthcare. Right. So I'm going to stop there. And we pick it up again tomorrow afternoon. I think we are on at 2 o'clock. 2 o'clock, we're going to have Professor Colette Cunningham-Myrie, who will start off with looking at cost effectiveness, cost utility, and all of these things, economic evaluation. And I'll pick it up later in the afternoon with some things pertaining to the health financing side purely. And we'll go from there. And so see you on location tomorrow. Right, stop share. Good.
Okay, take care, sir.
Right, good. Okay, then.
Thanks, sir.
Yes, all right.
All right, thank you. Have a good evening.
Okay. Well, the good thing we did not have rain. We did not have rain this afternoon to power the roof.
It was raining a little bit earlier.